inventions of the human race. Grant that all those who use these implements improve their lives. They recognize that robot or putting robots may learn to carry out your will more readily. We ask you to Christ, O Lord.
आज पिलर हॉस्पिटल में नया सीटी स्कैन इनॉग्रेशन हुआ है। हम इस सीटी स्कैन का स्पेशलिटी क्या है हम बोलने वाले हैं। देखो, ये वाला स्कैन कंपैरेटिवली अदर स्कैन के हिसाब से ये बहुत फास्ट है और रेडिएशन इफेक्ट है ना, ये 40% कम होता है। जैसे हम जो भी एक्सरे लेते हैं हमको रेडिएशन को डोज मिलता है ना, वो थोड़ा कम होता है। और अच्छे वाला चीज़ है ये जो रिपोर्टिंग करते हैं ना, हम इधर जब इमरजेंसी का कोई पेशेंट आएगा तो इसका स्कैन होने के बाद जो हमारे डॉक्टर चेन्नई में रहेगा तो भी उसको दे के हमको रिपोर्ट मिल सकता है और एक तुरंत हमको रिपोर्ट मिल जाएगा और ट्रीटमेंट जल्दी शुरू होगा। इसके हिसाब से ये वाला सीटी स्कैन यहाँ का पेशेंट्स के लिए बहुत अच्छा है। हम पिलर हॉस्पिटल मैनेजमेंट को इतना अप्रिशिएट कर रहे हैं कि ये वाला फैसिलिटी यहाँ तक उन्होंने पहुँच दिया है एंड हम बहुत खुश हैं कि हम भी इसमें एक हिस्सा ले रहे हैं। थैंक यू। Good evening, dear friends. It's been an auspicious day. We are here gathered together to have an inaugural function of the new imaging modality, that is the CT scan. You know, Pillar Hospital has been there for years together, being a pillar of healthcare system in this island, Andaman and Nicobar. We all should understand that any health condition, a doctor has to take a decision based on an investigation modality. Either it may be a blood test or a scan. Say it's a patient coming with inability to move his limbs. We are suspecting a stroke. We need an immediate scan. Or a patient coming with an abdomen pain. We need to know whether it is a stone problem in the kidney or it is a gallbladder problem or appendicitis, which is a common thing. 50 years before, we have been treating it based on clinical signs and symptoms. But nowadays, with available of modality, we can diagnose the patient very quick and plan the treatment accordingly. So in that aspect, I am just seeing Pillar Hospital has been been improving its investigation armamentarium. Basically, they had endoscopy recently, and now they have ventured into a very good CT scan imaging system where it bridges the gap. If there is a delay, it's going to affect the patient. So there is a gap in the healthcare system, which this imaging modality is going to help lot many people. The one important thing is it's an advanced machine, particularly when compared to other machines here available here. And then there is a very good team. We are coming from SRM Prime Hospital, Ramapuram, Chennai. I am Dr. Arul Prakash. I am a gastroenterologist. And Dr. Jeffrey is the head of radiology. He is going to be in touch with the radiological team here and is going to be reporting them. In case of emergency, we are going to immediately release the report and alert the doctor what can be done next. If it's a stroke, what can be done. So it's going to help them in a big way. So, I mean, this is one of the important imaging modality which will help this citizens here to improve the healthcare. So I'm really happy to be part of this pillar team in organizing and inaugurating this new equipment. Thank you. I'd like to ask Dr. Jeffrey to update about the imaging.
Here we've installed now GE, which is 32 slice. It's GE Revolution Aspire. So this is one of the first installations here in the islands. And what, compared to the other CTs, what is different in this? It's faster and the breath holding time is very less. So it is compatible, patient compatible. You need not breath hold for a long time. So patients are more comfortable during the procedure. So that is one. And there's most important thing is there's 40% dose reduction. In a CT, you get more of radiation. But in this CT, which is one of the latest in the 32 slice sector, there's 40% dose reduction when compared to the competitors. So that is the most significant part. And more than collaboration of SRM and Pillow Hospital, I would like to say, this is a landmark where we are taking teleradiology services. We are going to report CT from Pillow hospitals. So the reporting is going to be like how we report in our hospital immediately. So whenever an emergency case comes from the casualty or from the ICU, we look into the scan and we work. Our actual goal is, bridging the gap between technology and accessibility. Before there was a bridge between technology and accessibility, but with teleradiology we are just bridging it. And I think, both. I would like to thank both the hospital directors, for making this happen for the benefit of the patient. It would be actually beneficial for the patients.
Pilla Health Center was established in the year 1976 with the mission of providing quality healthcare facility to these people of Ireland, especially the poor and the marginalized. We are here for past 49 years. We have been expanding our facilities and services to meet the ever increasing healthcare needs of the public. With this state-of-art scan facility, we have upgraded our health facility to these people of Ireland, wherein they do not go to mainland to take a CT scan, which we want to make it available so the poor and the needy people can be benefited. And I also thank to the SRM Prime Hospital doctors team for their availability to collaborate with us in helping the poor and the needy people of this island.
Sir, I have a few questions actually. The questions are not related to this inauguration, but there's peculiar problem in Andaman Nicobar Island because healthcare in Port Blair and South Andaman district is improving slowly. Thanks to the private sector, especially hospitals like Pillar and other hospitals, it is improving slowly. But still, Andaman Nicobar Island has that problem because uh, we consist of many isolated islands from Diglipur to Campbell Bay. So these kind of facilities like CT scan and everything, these machines cost a lot. So government is not able to provide all these kind of diagnosis facilities in remote islands. Say for example, Campbell Bay, which is the southernmost island, with a population of 8,000. Government is not able to provide anything beyond an X-ray machine there. So how do we solve this challenge? Because diagnosis is important even for patients in all those remote islands also. And because of non-availability of advanced diagnostics, there a lot of patients suffer. Suppose somebody has a kidney stone problem. So doctors often diagnose it as gas or something else at first, and they provide them with gas medicines, and at the end when they are not able to recover with that medicine, then they refer them to Port Blair, and then when ultrasound or CT is uh, performed, and then only they are diagnosed with kidney stone. So all these kind of problems are there, which is common here, but it seems unsolvable because of the cost of machines involved. So what is the solution? Do you see a solution in near future like for this?
So yeah, it's a very valid question, but unfortunately, as of now, we don't have an answer. But what we can assure is, like previous years, even in Port Blair, we didn't have this facility. So now gradually things are improving because of the technology advancement. Like you can get a report from somewhere else. No need to have a person over here. And there are instruments which are portable nowadays. Not I'm not talking about the in CT like imaging. There are ultrasound machines. So as time goes, there is going to be a technology change, and we should be expecting something or the other to help the patients in the remote places where they cannot access. So I think it's the government policy and the technology has to improve, and probably we can expect certain things to happen. So till then, we have to travel to the nearest available place to get all these facilities. I mean, it's a difficult question. You also know the answer. It's not very easy to invest on, and you need a technicians for that. You need an expertise to report on that. If it goes for a repair, it will be a technical problem. But there are technologies improving. There are portable ultrasound machines. There are ECG machines, echo machines. Just we need a, technology to improve and the available technicians to go further. We are already visiting regularly, but particularly for this imaging, it's a teleradiology, sir. Like immediately after the scan is over, it will be transferred to the radiologist or head of the radiologist and their team. They'll be seeing there the imaging and they'll be reporting that to the doctor immediately. It's all happens in a minute or
It's
as quick
just
as
like
possible.
accessing the images in your computer immediately, sir.
It's like an internet.
So
You
once,
just see the images
once
there.
the images are acquired, it will be pushed into the cloud. So that cloud, I can access that cloud through my password. Uh, Immediately, it'll be like reporting my hospital cases. So it'll be like then and there immediately.
So whatever happens in that hospital, like whatever time frame, we can report the same thing here. So you don't need a person sitting here, but an expert who has a very good knowledge about the radiology, he can report the film and send the report.
It's almost like round the clock coverage.
Virtually,
you
he's
know.
sitting here. That's what simply.
Yeah, the tech saloon will be here. They'll just collect the images. That's all. So we'll be reporting there, and we'll coordinate with the team here, the team of doctors here, and we can improve the